Have you ever wondered if your body could be warning you about a heart attack days, weeks, or even months before it happens? The surprising answer is yes. Many people expect a heart attack to begin with sudden, crushing chest pain. While that can happen, the reality is often very different. In fact, many early warning signs are so mild or unusual that they're mistaken for stress, indigestion, aging, or simply having a busy day. By the time people realize something is seriously wrong, valuable time may already have been lost. In today's video, we're going to explore 7 commonly overlooked symptoms that could signal your heart needs immediate attention. These symptoms don't always mean you're having a heart attack, but they should never be ignored, especially if they appear suddenly, are new for you, or occur together. I'm Dr. Ethan Carter, and my goal is to help you better understand your health so you can recognize important warning signs early. This video is for educational purposes only and is not a substitute for professional medical advice. If you ever think you or someone else may be having a heart attack, call your local emergency services immediately. Now, let's begin with symptom number 1. Chest pressure, not just chest pain. When most people think about a heart attack, they imagine severe chest pain that knocks someone to the ground. But many heart attacks don't start that way. Instead, people often describe a feeling of pressure, tightness, squeezing, heaviness, or fullness in the center of the chest. Some say it feels like someone is sitting on their chest. Others compare it to wearing an extremely tight belt around the upper body. The sensation may come and go. It may last only a few minutes before disappearing, and then returning later. Because it isn't always sharp or unbearable, many people assume it's heartburn, muscle strain, or simple fatigue. This is especially common in adults over 50, people with diabetes, and women, who may experience less typical symptoms than men. If chest pressure appears during physical activity, emotional stress, or even while resting, and particularly if it's accompanied by sweating, shortness of breath, nausea, or discomfort spreading to other parts of the body, it deserves immediate medical attention. Your heart muscle depends on a steady supply of oxygen-rich blood. When blood flow becomes blocked, the heart sends warning signals, and chest pressure is often one of the earliest. Never assume it's just indigestion without proper evaluation, especially if the feeling is unusual for you. And the next symptom often appears at the same time, even though many people don't realize it's connected to the heart. Pain that travels beyond the chest. Here's something many people don't know. Heart-related discomfort doesn't always stay in the chest. The pain may spread into your left arm, both arms, shoulders, neck, jaw, upper back, or even your teeth. That's because the nerves carrying pain signals from the heart share pathways with nerves serving other areas of the body. Your brain can sometimes interpret those signals as pain somewhere else. Some people feel an aching shoulder. Others experience jaw pain that seems like a dental problem. Some notice discomfort between the shoulder blades or in the upper back. The pain may feel dull, burning, aching, or like pressure rather than something sharp. This symptom is easy to dismiss because it often doesn't seem related to the heart at all. Imagine waking up with pain in your jaw and shoulder after gardening the day before. Many people would assume they simply slept in an awkward position. But if that discomfort appears alongside chest pressure, unusual fatigue, nausea, or shortness of breath, it should never be ignored. Pay attention to patterns. Does the pain become worse during physical activity? Does it improve with rest? Is it completely different from anything you've experienced before? Those details matter and can help healthcare professionals determine whether your heart could be involved. Now, let's move to another warning sign that's especially common in older adults. Shortness of breath. Have you ever climbed a flight of stairs and suddenly felt much more out of breath than usual? Shortness of breath can happen for many reasons, including lung conditions, anxiety, or lack of exercise. But it can also be an important sign that your heart isn't pumping blood efficiently. When the heart struggles to circulate oxygen-rich blood throughout the body, your lungs may begin working harder to compensate. You might notice yourself becoming breathless while walking across a parking lot, carrying groceries, climbing stairs, or doing activities that never used to be difficult. Some people even wake up at night feeling like they can't catch their breath. Others notice they need extra pillows to sleep comfortably because lying flat makes breathing more difficult. These symptoms should never be dismissed, especially if they develop suddenly or are accompanied by chest discomfort, dizziness, or unusual sweating. Your body is remarkably good at adapting over time. That's why many people don't notice gradual changes until everyday tasks suddenly become exhausting. Ask yourself, can I still do the same activities I could comfortably do a few months ago? If the answer is no, and you can't explain why, it's worth discussing with your healthcare provider. Sometimes your heart is quietly asking for help long before a major emergency occurs. Unusual or extreme fatigue. Everyone feels tired from time to time. A busy week, poor sleep, or stress can all leave you feeling exhausted. But there's a big difference between ordinary tiredness and the kind of fatigue that can sometimes signal a heart problem. People often describe it as feeling completely drained for no clear reason. Simple tasks that were once easy, walking the dog, climbing a few stairs, grocery shopping, or even getting dressed, suddenly feel overwhelming. Some people say they feel like they just don't have any energy, even after a full night's sleep. This type of fatigue can be especially common in women, although it can affect anyone. Your heart is responsible for delivering oxygen-rich blood throughout your body. If it's struggling to pump efficiently, your muscles and organs may not receive the oxygen they need, leaving you unusually weak or exhausted. If this kind of fatigue appears suddenly, continues for several days, or is accompanied by other symptoms we've discussed, it's important to speak with a healthcare professional promptly. Cold sweats and nausea. Here's the symptom that surprises many people. A heart attack doesn't always begin with pain. Sometimes the body responds with sudden sweating, nausea, or even vomiting. Imagine sitting quietly, doing nothing physically demanding, when you suddenly break out into a cold, clammy sweat. Your skin may feel cool. Your clothes may become damp. You might also feel sick to your stomach without any obvious reason. Many people assume it's food poisoning, a stomach virus, or simply feeling overheated. But when cold sweats and nausea occur together with chest discomfort, shortness of breath, or pain in the arm or jaw, they may be signs of a medical emergency. Your body's nervous system reacts when the heart is under significant stress, and that reaction can trigger these unexpected symptoms. If something feels seriously wrong, trust your instincts and seek emergency medical care immediately rather than trying to wait it out. Dizziness or feeling faint. Have you ever stood up and briefly felt lightheaded? That can happen to almost anyone. But persistent dizziness, sudden faintness, or actually losing consciousness is different. When your heart isn't pumping enough blood effectively, your brain may receive less oxygen-rich blood than it needs. As a result, you may feel lightheaded, dizzy, unsteady, like you might faint. Some people describe it as feeling off balance or like the room is spinning. Others suddenly need to sit down because they feel they might collapse. While dizziness has many possible causes, including dehydration, medication side effects, or inner ear problems, it becomes much more concerning when combined with chest discomfort, unusual fatigue, shortness of breath, or cold sweats. Never ignore repeated episodes, especially if they're new or unexplained. An unexplained feeling that something is seriously wrong. This final symptom isn't something that appears on a blood test or x-ray. It's something patients have described for decades. Some people experience an overwhelming sense that something isn't right. They can't explain exactly why. They simply know they feel different. Some become unusually anxious. Others describe a feeling of impending doom. Although anxiety alone does not mean someone is having a heart attack, this unexplained feeling, especially when it occurs together with physical symptoms we've discussed, should never be dismissed. Your body sometimes notices changes before your mind fully understands them. If you experience multiple warning signs together, it's always safer to seek immediate medical attention than to hope they'll disappear on their own. When should you call emergency services? Seek emergency medical help immediately if you experience symptoms such as chest pressure, squeezing, or pain lasting several minutes or returning repeatedly. Pain spreading to the arm, shoulder, neck, jaw, or back. Shortness of breath, especially with chest discomfort. cold sweats, nausea, or vomiting along with other heart-related symptoms. Sudden dizziness, fainting, or loss of consciousness. Do not drive yourself to the hospital if you believe you're having a heart attack unless there is absolutely no other option. Calling emergency services allows trained professionals to begin treatment as quickly as possible.